Hello. Hi, this is Dr. Vivian, and I'm a pediatric dentist practicing in IC Colony, Borivali West at Little Star Children's Dental Clinic. I hope I'm audible to everyone. And so today we'll be discussing a very important topic, that is, why is milk teeth important? Okay, so there are many, most of the parents who come to me, they usually have this problem about, they come with decayed milk teeth, which sometimes is having pain or swelling and all these problems. So, in small children, many times parents think that these are milk teeth, they are going to fall down, within few years, and then a new permanent teeth will come. So many of times they ask me, doctor, आप निकाल दो ये दांत. Why don't you just remove it, ताकि the permanent teeth just comes like that. So first of all, we have to understand that milk teeth, every milk teeth has a particular time when it has to fall and when it has to come in the oral cavity or in the mouth. Okay. So when we are talking about milk teeth, the first and the foremost thing you have to understand is that when it is coming in the mouth, it is already inside the bone of your jaw, and then when it is coming up, it also leads to the development of the jaws. So the lower jaw and upper jaw, both the jaws, they will start developing as the milk teeth comes in the mouth. Okay, so the first function or the first importance of the milk teeth is the growth of both the jaws, the lower and the upper one. So first is the growth of the jaws, that is the bone of your jaws are growing with the teeth. One. Second is the muscles. So as the child grows, when the child bites using those teeth, it also leads to the growth of the muscles and also the joint. So there is, whenever we open our mouth like that, there is a joint which is close to our ears on both sides, which we call it as the temporomandibular joint. So this temporomandibular joint is the one that is required in future also. It helps in chewing perfectly. It helps in your smile. It helps in keeping your facial symmetry. अगर एक साइड में भी दांत कम रहा, so there is a possibility that this joint may not develop that well. So you need milk teeth on both sides equal in number, 10 in the upper jaw total with the molars and the canines and the incisors. There should be 10 on the upper jaw and 10 in the lower jaw. So that helps in the growth of these muscles that are there, okay, for chewing, and also this joint. Okay, this joint also now indirectly helps in the breathing. So jitna hum, the opening of this area is, that also leads to that opening. It helps in the opening of the airway. Otherwise, there are sometimes children, they have breathing problems as they grow later because their milk teeth are not developed. So these are all the first and the foremost important things which affects the other parts of the body around over there. Then the other important functions of milk teeth we already know, like for example chewing. So if the milk teeth are not coming or if they are decayed, then children, they are not able to eat nuts or hard things, right? Then they'll only want soft diet. Many times small children, they have decay right from the beginning, so they don't know that sometimes that hard food hum kha sakte hain, because they have decay right from the beginning. When they are just 1.5 2 years, they eat only soft food, and parents think नहीं मेरा बच्चा कड़क नहीं खाता है, but that is not the fact. अगर आपका बच्चा कड़क नहीं खा रहा है, चकली या फिर nuts नहीं खा रहा है, so that means there is something wrong. That means there is some decay or his milk molars have not erupted. So you have to understand that there must be some problem. Okay, now that is the second important function. So chewing, the health. The first point was the growth of your jaws, upper and lower jaws. Second is the muscles and this joint, temporomandibular joint growth. Third is the chewing activity, which helps again in the nutrition for the child. Now, fourth important function is, as the child grows, you know that the milk teeth is finally going to be replaced by the permanent teeth. Now, what happens is, wherever the milk teeth is there, there is a replacement for it, and that milk teeth falls and the permanent teeth comes exactly in the correct position. If the milk teeth gets decayed, then what happens? There is a chance that the permanent teeth will not come in its correct position, because when there will be a decayed milk teeth, or if the milk teeth doesn't come out only, that space will close. जहाँ पे वो दांत होनी चाहिए, अगर दांत नहीं रहेगी तो बगल वाला दांत वहाँ पे शिफ्ट हो जाएगा और वो जगह बंद हो जाएगी. तो परमानेंट टीथ कैन नॉट कम इन द करेक्ट पोजीशन. तो कभी कभी वो आगे आ जाता है या फिर पीछे आ जाता है. And if this happens, yeah, if it is in the front or in the back, if that permanent teeth is coming, then what will happen, again he'll have problems in biting, and the appearance also, especially if it is in the front teeth, agar wo aage piche raha, so it will look very bad. Okay, so this is the another important function. So it helps in the correct positioning of your permanent teeth when they have to erupt. This is another important function. Then, when we talk about milk teeth, there is another very, very important function that it has is it guides the the jaw movement. So, for example, when you are swallowing, so basically functions of breathing, functions of chewing. If supposing you do not have enough milk teeth, it when the child is swallowing like that, or if the child is biting on something, he will develop a wrong habit or a wrong style of biting, which again will lead to other problems, okay, or asymmetries of the face. Similarly, as I mentioned before, also because of the growth of the jaws and the muscles and this joint, even the breathing activity, okay, if it is not well developed, even your breathing activity gets affected. Okay, so now, since you know that milk teeth is important, many times parents will wonder, okay, if milk teeth is important, then when should I go for a first visit to the doctor? Now, most of the times you all will think, okay, हम pediatrician को दिखा रहे हैं, तो बस अब pediatric या फिर dentist के पास जाने की क्या जरूरत है? But let me tell you, going to the pediatric dentist is very important, and you should go to the pediatric dentist जब आपको पहले ही दिन फर्स्ट टूथ जब आपको दिख जाएगा मुंह में इरप्ट हो गया या फिर इट इरप्ट्स एंड कम्स इनटू द ओरल कैविटी, that is the right time for you to go to the dentist, and preferably go to the pediatric dentist. Why we tell you to do that is because we can check if there is something wrong in the tooth. Okay, if there is nothing wrong in the tooth, we will give you what all oral hygiene aids you have to do, means घर पे उसको कैसे clean करना है, all that instructions we can give you. And many times in the small children, especially the upper front teeth, ऊपर के जो दांत रहते हैं, वो feeding के बाद the milk gets stuck over there on the upper front teeth, and that starts causing decay. But many times, because there is no pain, the parents, they ignore that. You should not ignore that. You have to go to the pediatric dentist and get whatever preventive treatment we can do for the child at the earlier age. Okay. So before I go into the preventive strategies, and first of all, you have to go at the age of 6 months only. You have to get the first dental checkup for your child, and then from there on, every 6 months, one checkup is recommended. Okay, every 6 months, in even adults also, once every 6 months, you have to get a normal dental checkup done. Now, before I get into the preventive strategies, let me tell you how you can at home identify if there is something wrong with your milk teeth. Everybody knows that the tooth color should ideally be milky white in color. For a deciduous teeth or the milk molar are usually milky white in color. The moment you see there is some brown spot or a black spot, or sometimes it is even yellowish brown is stuck in the teeth, or you can see some points which are not normal or any other color than white, you should go and meet the dentist. So I'll explain to you what and how much what are the levels in the teeth, and what is the what is exactly decay. But before that, I'll just show you one small diagram. I hope you can see this. So the outermost layer of a teeth is called enamel. You can see that in purple. Then you can see in the orange color or little yellow ochre color the dentine, and the innermost layer is the pulp. Okay, so you have enamel, which is the outermost layer, then you have the dentine, and then you have the pulp. Whenever the decay, supposing आपको brown spot दिख गया, and if the brown spot is only in the enamel, or if it is in the dentine, I'll just show you in the diagram. Just hold on. Like in this picture I've shown you now, if the decay is from the enamel to the dentine, up to the dentine, the child will not have much pain, or may have pain only when he drinks cold or when he's eating an ice cream. So that is more like a sensitivity. So at this stage is the best stage for you to rush to the doctor, to a pediatric dentist, so that we can just do a small filling, a dental filling. And that too in children we do that same tooth colored filling. After doing the filling, you won't even know that is a filling. Okay, there is a filling over there. But at this stage, we can prevent pain for the child. We can prevent any kind of infection entering the body of the child. Okay. So dental decay is a form of infection which starts on the enamel, then enters the dentine. So in enamel and dentine, when the decay is there, we can do a normal filling. Okay. But the moment the infection reaches the pulp, now this pulp over here, so the infection, supposing here you can see, and this we can visualize in our X-ray. This is what we do in the X-ray. When we see that this decay is entering from the enamel to the dentine to the pulp, when it reaches the pulp, that is when the child starts saying कि मुझे दर्द हो रहा है. Okay, and that is when the pain starts. And this pain doesn't stop. There is a difference between sensitivity. Sensitivity is only when you're drinking the water or you're having ice cream. The pain is there for a few seconds and it goes away. But when the decay has entered the pulp, the pain remains for 1 hour, 45 minutes, and sometimes the pain doesn't go till the child is given medication. So at this stage, we have to do a root canal. Many times parents say कि अरे ये तो दूध का दांत है, इसमें क्यों root canal करना है? ये आप निकाल दो. Again, I'm telling you, for the so that all the functions, the normal functions of the body should continue, the jaws should continue, we have to save every teeth, every milk molar till the time it has to fall, we have to save it. Okay. So for those reasons, we'll have to do a root canal treatment. But supposing if the child is 6 or 7 years of age and his front teeth is decayed, we can remove it because the front teeth, only the front upper four, 1, 2, 3, 4, and 1, 2, 3, 4, all these four teeth will fall between the age of 7 and 9. सो इफ द चाइल्ड इज 7 years old एंड उसका दूध का दांत है सामने वाला जो खराब हो गया है वो हम निकाल सकते हैं. बट पीछे के जितने भी दांत, व्हाट यू कॉल इट, द मोलर्स या फिर दांत जो है, दैट वी हैव टू सेव इट. ओके, एंड दीज आर द वेज टू सेव. वी कैन आइदर डू अ फिलिंग or sometimes we have to do a root canal treatment. Okay, along with this root canal treatment, we do a permanent filling and then a cap on that. Now a third scenario, sometimes parents ignore, like ये पेन हो गया तो बच्चों को दवाई दे देते, दवाई के बाद पेन कम हो जाता है लेकिन कुछ महीने बाद वो इन्फेक्शन और अंदर जाती है. So as the infection goes more deeper and into the bone, there is sometimes swelling or there's a pus collection in the bone, and at that times we cannot save this teeth. Okay, we cannot do a root canal sometimes and we have to remove the molar. Now you'll think, if you're removing the molar, then what will we do? Or how will the permanent teeth come in its exact position? Because as I mentioned, अगर एक missing molar है या फिर missing एक दूध का दांत अगर missing रहा डीके के वजह से या फिर वो ऊपर ही नहीं आया, तो हम क्या करेंगे? बिकॉज वो स्पेस बंद हो जाएगा, परमानेंट टीथ जगह पे नहीं आएगी. सो टू प्रिवेंट दिस, वी हैव समथिंग कॉल्ड एज अ space maintainer. Okay, what we do is we remove that tooth and then we place a ring in place of that which maintains all the remaining teeth in its correct position so that the other teeth will not shift in the space. So these are the treatment options. Okay, but before going into this treatment options, there is some very simple things that you can do at home to avoid this situation. Okay, to avoid this dental decay on the whole, there are certain things that you can follow at home. First is brushing the teeth twice. Those children who are below the age of 3 and above the age of 8 months, 7 to 8 months, you can start taking a very thin layer, okay, or what we call it as a smear layer of non-fluoridated toothpaste. Actually, till 1.5 year old, you can use that smear layer. एक पतला सा layer on a soft bristled baby toothbrushes. Soft bristled baby toothbrush. You will have to put the smear layer of a non-fluoridated toothpaste, जिसमें fluoride नहीं रहेगा. Non-fluoridated. बच्चों के toothpaste जो आते हैं, Chico and some Colgate toothpaste are there which are non-fluoridated that you can use. Okay, and you have to use it in the circular motion. Soft bristled toothbrush in a circular motion inside the oral cavity. And this has to be started the moment the first tooth arrives. For those infants who do not have the teeth, after the feeding, you have to take a cloth, okay, dip it in warm water and run that wet cloth all over on the gums of the baby, even if the teeth is not there, and remove all the residual milk that is remaining in the mouth. That is how you clean for small infants. And up to the age of 3, it is a non-fluoridated toothpaste. Then between the age of 3 and up to the age of 8, they can start using fluoridated toothpaste up to 500. Okay, 500 ppm. So there is Kedodent, there is Cheerio, okay, there is Pediflor. These are the three toothpaste that is commonly available in our Indian scenario. In your pharmacy, you will get this toothpaste which you can use, and they contain 500 ppm of fluoride. So this is the recommendation for up from 3 to up to the age of 8, 9. Mainly it is because at this ages there are chances that they might swallow. That is why. Okay, if the child is not swallowing the toothpaste and all and is very good, you can even use the adult toothpaste which is having 1000 ppm of fluoride and above that. Also, children who are 8, 9 years and above, they can start using that. Another very good important point is those children who are about 9 and above, they can start using a toothpaste called GC Tooth Mousse. Okay, this particular toothpaste you will only get it on Amazon. You won't get it in the pharmacy. So GC Tooth Mousse, it is like a mousse, like a cream. You have to apply that cream on all the surfaces of your teeth, and this is mostly important for your permanent teeth. So you apply it on your permanent teeth for 3 minutes, and after 3 minutes, you have to brush. So I'll mention the non-fluoridated toothpaste first, up to 3 years of age. Then between 3 to 8, you have to use Kerodent, Pediflor, or you can use Cheerio toothpaste. So these three toothpastes are there. Then for 8, 9 years and above, you can use the fluoridated toothpaste which you get normally in the market, like your Colgate and Pepsodent and all, which are having fluoride. You can use that, and along with that, you can use this GC Tooth Mousse, GC Tooth Mousse cream. You will get it on Amazon. Okay, so these are the preventive strategies that you can use. Also, it is very good to eat things like cheese and non-sugary things. So many times parents say कि मैं तो दूध में शक्कर नहीं डालते हम लोग, उसको सिर्फ Bonvita, we just put Bonvita या फिर we put Complan. But let me tell you, even Bonvita, Complan, or any formulas that you get in the market are all having sugar inside that. They are all having sugar, and they all, when they stick to the teeth, can lead to dental decay. Similarly, if the child has problems like asthma or chronically falls ill, because there are many syrups which the child consumes. So syrup is a very important factor which leads to dental decay between the age of 3 to 7. Okay, because syrup which you're having in the medicinal syrups like crocin and all, they all have sugars in it, and after you give that, that remains on the teeth and it causes decay. And in very small children who are 1 year and all, they get decay, as I mentioned, in the front incisors, and that is because of feeding habit. Feeding के बाद दूध रह जाता है वहाँ पे, and then bacteria attacks that food, causing the dental decay. And all that I mentioned to you are the preventive strategies that you can use to avoid this problem. Okay, this is at home. But when you come to the pediatric dentist, there is other two good options that we have to prevent dental decay. First is we do a cleanup, and after the cleanup, we do something called as a topical fluoride application. It is an absolutely painless procedure. It is just that drying the tooth, and then we put a paint-like thing. Okay, it's a lacquer paint or a varnish that we call it. You can call it like a varnish, which we apply it on the tooth surface and let it dry for a while. And the child, we can prevent dental decay by just doing this topical fluoride application. Also, there is for the molars, because many times after we eat food, you know that the food gets stuck in the molars because they have something called as grooves or depressions in that, which are naturally present. So dental decay can start. They are very susceptible to dental decay. So we do something called as a pit and fissure sealant. You can even go on Google or YouTube, and you can type in topical fluoride application and pit and fissure sealant. There is a lot of information online, and both these procedures are absolutely painless. We don't even have to drill the tooth. It is just simply cleaning the teeth and painting the teeth, which many a times children enjoy. They really enjoy when they come. We paint the tooth, we put the blue light, so they see all that and they really have a good time in the dental clinic. So these are the preventive strategies that we can adopt. And when all this doesn't work, and when you see that black spots or something is happening to the tooth, then we have to do all these fillings, or sometimes a root canal, sometimes an extraction. So let's hope that we don't have to go to that. So to avoid all these, first things is a dental visit first at the 6 months of age of the child. After 6 months, every 6 months you have to keep following up and having a dental visit. While doing the dental visit, we can start with the topical fluoride application. You should get your sealant, pit and fissure sealant, so that the molars don't get decayed. and then use the toothpaste as I mentioned. Okay, so that should prevent all these problems. So now I will start taking the questions that are there. I will start answering the questions. Okay, just hold on. Yeah, so I'm going to ask the first question, that is answer the first question. This is from Rachel. Hi doctor, how long after teething does teeth come? So after teething, usually the teeth should come within a month, within 1 month or 2 months. If it is taking more than 1 month, 2 months, or if the child is in pain, or if you can notice there is a bluish color swelling, then you have to come to the doctor, to the pediatric dentist. And there is sometimes, this happens very rarely, but sometimes we have to make a small opening so that the teeth can come normally. This doesn't happen usually. It usually the tooth easily comes out within a month, 1 month or 2 months max, not more than that. Okay. So there's another question from Vanessa Varghese. She asks, is root canal safe for children? So root canal is safe because root canal is, to be very frank, root canal is just any normal minor surgical process. So supposing if a child has a fall and he has a small cut on the forehead, what we have to do? We have to suture it. Okay, we have to stitch it or suture it. So that time we give something called as local anesthesia, so that this area becomes numb and we can easily suture it. Similarly, in root canal, what is happening? The pulp or the inside part of the tooth has got infected, and since it has got infected, we have to clean that area and we have to remove that small tissue, and it is a very tiny tissue. It's not a major surgery, very minor, just as much as a small cut, just that much. So we give the local anesthesia and we remove that infected pulp of the tooth, and again we restore that tooth. So it is absolutely safe for children. You don't have to worry about that. Okay. Another question from Vanessa Varghese again. Will permanent teeth get affected if we remove milk teeth? So this is another common question which most parents ask. Will the permanent teeth get affected if we remove the milk teeth? Yes, it will get affected if we do not put the space maintainer. So as I mentioned to you earlier, that after extracting the milk teeth, sometimes we have to extract. If there is too much infection, we have to extract. Or sometimes the milk teeth apne aap gir jata due to infection. The child or the parent is neglectful and it goes away. And if we do not put the space maintainer, then the permanent teeth may come in the wrong position. So to avoid that, we will have to, get the space maintainer treatment done. So permanent teeth can get affected if we remove the milk teeth and if space maintainer is not placed. The next question is from Jansi Varghese, and she asks, can a cavity in deciduous teeth affect permanent teeth? Yes. So the deciduous teeth can, as I mentioned earlier, that it will affect the permanent teeth when the infection reaches the pulp. When the child starts saying ki dard ho raha hai, that means the infection has gone down into the bone. And this sometimes, if it leads to pus formation, this pus goes inside the bone and can affect the permanent teeth, but not 100% of the time. There is some 5 to 10% chances that it can affect the permanent teeth. Moving on to the next question. Can a cavity in deciduous teeth affect permanent teeth? So this also is a similar question that is asked. Okay, another question from Rachel we have here. She asks, which teeth are most painful for babies? So there is nothing like which teeth are most painful. It is just that when the molars are coming, it is more painful because they are more bigger teeth. The front incisors are smaller in size and shape. So when they are erupting, they usually won't cause any pain. Okay. And that same, the teething question that you asked, it takes 1 to 2 months, and within 1 to 2 months, they will erupt in the oral cavity. Okay, so again, leading to the same question, what are the symptoms of teething in baby? So in teething, the symptom will be the child will be cranky. Okay, they will want to bite on all the surfaces. Whatever they get in the hand, they want to keep biting hard onto it. And also, you will see that the gums are become red and sometimes a little swollen. Okay, and to ease the baby through the teething process, what you can do is you can take a large carrot or something and keep it in the fridge, not for too long, but just so that it remains a little below the room temperature. And then you can ask the child to bite on it. So when they bite on that cold surface, the redness and the inflammation, which is the pain that they are getting while it's teething, will reduce. Okay, so that's a good home remedy. Apart from that, there are certain medications that we prescribe, but that after the checkup, when we have a checkup, we can discuss and give it to you. Okay, but at home you can do that. You can take carrot, a big piece, not small piece. If it is a small piece, the child might sometimes swallow it and may get choke feeling, get that choking feeling while if it is a smaller piece. So make it big enough so that the child will not be able to swallow it. Then another question is from Lakshmi Mishra is asking, what is the difference between the deciduous and the permanent teeth? What is another name for milk teeth? So milk teeth is also called as primary teeth. It is called as deciduous teeth. Okay, or it is also called as a first teeth that comes. So these are the different names: primary teeth, deciduous teeth. These are the other names for milk teeth. And the main difference between the deciduous and permanent teeth is that the deciduous teeth are smaller in size. The permanent teeth are obviously larger. Okay, and also the permanent teeth will come. The first permanent teeth erupts in the oral cavity at the age of 6 years, and this is the permanent molar. When this first permanent molar comes in the mouth, none of the milk teeth will fall. So don't get confused. At the age of 6, the teeth that is erupting सबसे पीछे on all the four corners, they are called as the first permanent molar teeth. They are the first permanent molar. They are not milk molars. Okay, milk molars will erupt. First one will erupt from down at the 6 months of age, and all the incisors will come by the when the child is around 1.5, and by 2.5 to 3 years of age, the remaining molars will be erupted in the oral cavity. Okay, so this is the difference. So up to 3 years, whatever is erupting in your child's mouth is all milk teeth, and whatever starts coming after the age of 6, okay, that will all be your permanent teeth. That is the major difference, which you will be able to differentiate easily. The next question is, what is the age of milk teeth falling? Again, by Lakshmi Mishra. So the milk teeth uh, first, as I mentioned to you, that first permanent molar will come at the age of 6. That comes without any milk teeth falling. Now, the first teeth that will fall is again the lower milk teeth incisors will fall. These front two. Okay, so they will fall at the age of 6.5, 7 years onwards. They will start falling. So all these front four, नीचे का और ऊपर का, 7 to 9 years के बीच they will fall and new permanent teeth will come. After that, the lower canines will fall. दोनों canine जो है, जो सबसे sharp tooth रहता है, that will fall, and the new teeth will come. This happens between age of 9 to 11, and then 11 to henceforth, you can say from the age of 10 to 13, 14, the remaining molars and the upper canine will fall and the permanent teeth will come. Okay, so first is the incisors between 7 to 9, the front incisors, then the lower two canines, then the upper molars, lower molars, and finally the upper canine. This all will fall after the age of 11. So I've got another question from Navlaks Kapoor, who asks, can a 6-year-old have teething symptoms? Yes, 6-year-old will have teething symptoms, but this is the teething symptom for that permanent molar that I mentioned, which comes right in the corner, and it is a big tooth. And it gives more pain actually when it is erupting because it is a large molar as compared to the remaining deciduous teeth. So a 6-year-old will have the teething symptom of a permanent first molar. Another question also is by Navlas Kapoor, why do loose baby teeth hurt? So this loose baby teeth is when the teeth is ready to fall. So obviously when it is ready to fall, what it does, it will keep moving. So supposing if you're biting onto something, if the tooth is moving, it will go and hurt the gums because it is moving, and that is normal. You don't have to worry. If it is paining too much and the child is unable to eat, then you have to come to the pediatric dentist and get that removed. Okay. If it is not causing any pain, then you can continue and wait for a month or two. And if it is still not falling, then we may have to remove it in the dental clinic. Otherwise, there is no problem. And this loose baby teeth normally hurts. It's very mild pain will be there because it is moving and it is about to fall for those reasons. Okay. So there are more questions over here. But again, by Navla Supur, what can I give my teething baby? So as I mentioned to you before, there are some passive, this carrot you can give. You can keep it in the fridge, and you even get those sticks, for small children, jeera sticks, or those, which are there in the bakery, which they can bite on. Okay, anything that is, and see to it that it is big enough that the child doesn't swallow. You can even use pacifiers. Okay, keep that in the fridge for some time. First you boil it in the water. Okay, of course that you will be doing it for your normal feeding also. So first you boil it in the hot water, then keep it clean, keep it in the fridge for a while, let it come little below the room temperature. Don't make it extra cold, just keep it little below the room temperature and give the child to bite on it. Okay, that I've already answered before. Now, next question is from Revati Rajmani. Why do humans have deciduous teeth? Okay, so as I mentioned, many of the animals in, if you see animal kingdom, many of them they have many sets of teeth. Like for example, rat, if their one teeth comes out, they have another teeth. They continuously keep producing. Whereas we have only two sets of teeth, that is the milk teeth and the permanent teeth. So at if you'll actually see a child when the child is born, you cannot actually have that big permanent teeth. The size of a permanent teeth is very large and they will not fit in that oral cavity at that time. So probably that is one of the reasons why we have this first set of milk teeth, because that is the appropriate size and shape for that size or for the baby, because the jaw size itself is small, so we need at that age smaller size teeth so that the child can chew and maintain the regular functions. Imagine if the jaw size is small and the teeth are extremely large. First of all, they look also bad and will not be able to be, it will not erupt properly in the oral cavity and it will cause a lot of pain and swelling. So that is why you have, first humans have the deciduous teeth, which then falls and gets replaced by the permanent teeth. Next question is by Bhavna Anatkat. Which teeth are the hardest for babies to cut? Okay, so which teeth are the hardest for babies to cut? So there is nothing like that, any teeth is hard for the baby. There's nothing like that. Ki ye hard. If the child is finding it difficult to chew, you mean to cut means to bite. I understand that is what you're trying to say here. But if the child is having some difficulty या फिर बच्चे को मुश्किल लग रही है किधर चबाने का, so that means something is wrong in the mouth. Okay, there is a possibility there is some swelling in the gums or there is decay in the tooth. These could be the reasons why the child is feeling it hard to cut or to bite. Okay, so then you have to come to the clinic, you have to get it checked. Then only we can come to know why the child is finding it hard to bite on. Okay. Okay, then the next question we have from Durga Salvi. How are teeth named? So there is teeth are named as there are mainly three sets of teeth in milk teeth. The first front four are called incisors. Okay, central and lateral we call them, but let's not go into that. The front four upper teeth and lower teeth are called as incisors. Uske baad there is a sharp teeth, this one, which we call it as the canine. Canine. So this canine are that, we call it the vampire teeth, or you can see in the lion and tiger the sharp ones which are tall. Those are called canines. Okay. We also have four canines, two on top and two below. That comes after the incisors. So okay, so then we have four canines, and behind these canines we have two molars, first molar and the second molar in both the jaws. So like that there are total 10 on top and 10 down for milk teeth. Okay, the only difference is that in permanent teeth there is something called as premolars. Canine ke piche there are two extra premolars. The remaining almost it is the same. So that's how you name them: incisors, canines, and the molars. Then we have Sonam Patel asking, what are the deciduous teeth? So deciduous teeth are the same thing. What I mentioned, they are the milk teeth. They are called the primary teeth. Deciduous teeth ka is another name for your milk teeth or the primary teeth. Okay, these are the first teeth that comes in the child's mouth, and then they fall in the permanent teeth. Uh, Another question we have from Madhavi is, how are milk teeth different from permanent teeth? This again I have mentioned. They are smaller in size. Permanent teeth are much larger in size. Milk teeth are there present from 1.5 year of the child up to 7 years. Up to 6 years are completely milk teeth only. Then slowly the milk teeth falls and the permanent teeth. That is how you can differentiate between the milk teeth and the permanent teeth in the child's mouth. Okay. So I think I have answered most of the questions. Let me just check if there is any more questions remaining. Okay. So most of the questions and queries I have answered now. Okay. So before I end this session, I would just like to give away some key points, or I would like to summarize the whole session that we had today. First of all, the first point is that milk teeth are extremely important, and I hope I have cleared that point very clearly. Okay. Now, that is the first thing. Second thing is you have to get your first dental visit to the child at the age of 6 months and onwards. Okay, first it starts from 6 months and then you go forward. Every 6 months you have to have one checkup, and this is even for the adults. The third point is when the child is below 3 years of age, you have to use a non-fluoridated toothpaste. Matlab the toothpaste should not have fluoride. Between the age of 3 to 7, you can use fluoridated toothpaste like Kerodent, Pediflor, or you can use Cheerio toothpaste. They have up to 500 ppm of fluoride. Okay. After that age, after 7 or 8 years, once the child develops this proper brushing habit and won't swallow the toothpaste, you can start giving 1000 ppm of fluoride. So like a normal Colgate toothpaste, and you can use GC tooth mousse, which you get on Amazon. Okay, so read the instructions of GC tooth mousse and use the toothpaste accordingly. Then get your preventive treatment done, like your topical fluoride application and the Pitt and Fisher sealant application. Okay, this is another thing. Then the moment you see even the tiniest black spot, you should rush to the dental clinic and get the filling done. Don't wait for the pain to start. The moment pain starts, then we have to do invasive procedures like root canal or extraction. So let's hope that you have gained from this session and you have understood how to take care of the child's teeth and to avoid this kind of pain and trouble in future. Okay. Thank you, and I'm going to end the session now. Bye. Have a nice day.